And welcome to today's webinar, Improving Sleep Quality After Brain Injury. Thank you so much for joining. My name is Rachel Ishak, and I'm a community outreach specialist at the Brain Injury Alliance of New Jersey. The Alliance is a nonprofit organization with a mission to improve education, awareness, prevention strategies, advocacy, and support for those who have been affected by brain injury. I would like to announce that we have some upcoming social events for brain injury survivors, which you can find more information about on our website. And we also have another webinar coming up on June 20th at 12 p.m. And this one is titled The Road to Recovery, the Continuum of Care for Individuals with Brain Injuries. So you can find more information about that and register on our website as well. We just have a couple of housekeeping notes before we begin the presentation. All the attendees' microphones have been muted, so if you have any questions during today's webinar, please type them in the Q&A box, and we will get to as many questions as possible at the end of the presentation. The webinar is being recorded and it will be available for viewing on the BIANJ website afterwards. At the end of the webinar, there will be a link for a post-webinar survey that will be placed in the chat. And we really value your feedback, so you are encouraged to complete the survey, and you must complete the survey in order to receive a certificate of attendance. So once you complete that survey, you will automatically receive the certificate of attendance via email. So today we have our two webinar presenters, Chris Yang and Nabila Inam. Christopher Yang is an occupational therapist who currently works at both Robert Wood Johnson University in New Brunswick and Riverview Medical Center in Red Bank. He graduated with his doctorate of occupational therapy from the University of the Sciences in 2016 and started off his career as a travel therapist. He has experience working in school-based, acute care, inpatient rehab, inpatient psych, skilled nursing facilities, and outpatient therapy. He is passionate about neurology and brain injury and has previously worked as the lead stroke therapist at a comprehensive stroke center in New York. He is interested in holistic and alternative medicine and actively explores non-pharmaceutical interventions to assist with his patient care. We also have Nabila. She has a Bachelor of Science in Health Science and a Master of Occupational Therapy from the University of the Sciences, and a Doctorate of Occupational Therapy from Salus University. Nabila also has a specialty certification in health and wellness. And before transitioning to academia, Nabila worked as a full-time occupational therapist for many years. Most of her work has been with long-term care and community re-entry with the adult traumatic brain injury population. Her clinical experience also extended to inpatient and acute care facilities. She has served as a senior occupational therapist, and she continues to work as a per diem therapist at a local hospital. Her research interest is in sleep and complementary integrative rehabilitation medicine. She has several publications on the topic of sleep, and she has also presented at national and state levels on sleep, yoga, and traumatic brain injury. So I am very pleased to welcome Christopher and Nabila.
Well, thank you, Rachel, for the introduction, and thank you, everybody, for joining us at this webinar. Next slide, please. So we hope that at the end of this session that you will have a better understanding about the prevalence of sleep disturbance after brain injury, and also understand the effect of poor sleep quality on health. Also learn about the sleep kits and how to create a sleep kit. Identify a minimum of 3 non-pharmacological interventions to help improve sleep. Next slide, please. So sleep has distinct stages. How rested we feel and how well we function depends not on only how much sleep you receive, but the quality of sleep. Sleep has 2 stages. So one is the rapid eye movement or the REM stage, and then there is the non-REM stage. Non-rapid eye movement sleep consists of 3 stages. So we go through these stages several times during our sleep. So the stage 1, which is the very light sleep stage, where you're kind of feeling drowsy, you're just maybe transitioning from wake to sleep, maybe dozing off during a conversation. It's very to arouse somebody from this stage. And then the stage 2, which is the light stage of sleep, where people spend about 50% of their sleep time. It's very easy to wake somebody from this stage, and also they become very quickly oriented. The stage 3 is the deep sleep, or also known as slow wave sleep. It's difficult to wake somebody from this stage, and if they're wakened, they're very disoriented for a while. Here, heart rate and breathing slows down. This is the stage of sleep where we receive the restorative sleep. So the more we are in the stage 3, we feel more rested when we wake up during the day. Young people spend about 20% of their time on the stage 3. As we get older, we tend to spend less time in stage 3. REM stage, this is where we dream and the dream occurs. So we enter this stage after 90 minutes into the sleep, where our muscles are very relaxed. And during sleep, our brain continues to work. It's transforming information to long-term memory and making room for new information and new learning to occur. Sleep is very important occupation, but many times we neglect this occupation because we have maybe a lot to do during the day or because we have difficulty with sleeping. Next slide, please. So the National Sleep Foundation provided a recommended amount of sleep. So in this chart, you see the amount of sleep based on individual age. So some people might need a little more sleep or less sleep to function well during the day, but average, this is how much sleep a person would need based on their ages. So as you can see, adult needs about 7 to 9 hours of sleep. Older adults needs about 7 to 8 hours of sleep. Next slide, please. So sleep disturbance occurs in 1/3 of US population. It is common problem even in general population. Center for Disease Control has considered insufficient sleep to be a public health problem. Insufficient sleep has been linked to motor vehicle accident. Also, it has been linked to development of number of chronic diseases, such as diabetes, cardiovascular disease, obesity, and hypertension. Next slide, please. So about 46% of individuals have sleep disorders following TBI. Common sleep diagnosis, sleep apnea, hypersomnia, and narcolepsy. It is important to recognize and manage sleep disorder in TBI patient because untreated sleep disturbances translate to longer hospital stays, higher cost of rehabilitation, and more disability. Next slide, please. So causes of sleep problem in TBI population can be due to several reasons. High prevalence of sleep problem in TBI can be due to damage to the sleep regulation center in our brain. So such as the midbrain, the thalamus, the pons, the hypothalamus, they all function and help with sleep. Also, there is an area in our brain called suprachiasmatic, which regulates the circadian rhythm, which is the internal clock for wake and sleep. So when there's a damage to any of this area in the brain, that could affect somebody's sleep. Also, TBI population found to have decreased level of hormones such as histamine and melatonin, which are also helps in fostering sleep. Also, there are secondary factors such as medication. So some medications side effect would be lack of sleep or sleep problem. So sometimes, people are in antispasticity medication like baclofen, which makes clients very sleepy, but can affect their sleep during the night. Some seizure medication cause sleep disturbance. Sleep and wake pattern can also be affected by sleep medications and affects persons falling asleep. However, no medication should be stopped without consulting with the doctor. Also present of comorbidity conditions such as headache, anxiety, depression, experience of trauma or having to adjust to ongoing disability may cause mood changes and may lead to sleep disturbance. Next slide, please. So some common sleep complaints after TBI. Hypersomnia, which is excessive sleepiness, is a condition in which a person has trouble staying awake during the day. People who have hypersomnia can fall asleep at any time, for instance, at work or while they're driving. Insomnia is also very common. It's trouble initiating and maintaining sleep. So a person may wake up too early or have difficulty falling asleep at night, and the lack of sleep affects their daily function. Also, the circadian rhythm, as I mentioned before, the part of the brain that controls this could be damaged, and it affects our internal clock, and which leads to sleep problem. Parasomnia is a catch-all term for unusual behaviors that people experience prior to falling asleep, while asleep, or during the arousal period between sleep and wakefulness. These behaviors vary considerably in terms of characteristic, severity, and frequency. So behavior can be sleepwalking, night terror, vocalization, or movement during sleep. Obstructive sleep apnea, it is a respiratory problem, occurs during sleep, where airway becomes narrow, breathing can stop, or person receives limited amount of oxygen while they're sleeping. Usually this individual uses machine like CPAP to help with breathing during sleep. And then narcolepsy, which is a daytime sleepiness and most apparent when person is sedentary or bored or in a relaxed situation. Next slide, please. So lack of sleep affects rehabilitation and recovery process. It is difficult to participate in daily activities without good sleep. So one can feel fatigue, lack of energy, or sleeping during the day. Individual stays in acute care on average 13 days longer than those without sleep problems. Lack of sleep can also cause decreased reaction time, difficulty to focus, attention to a task can be impaired. And because of TBI, a person can already experience, lack of attention or memory problem, and sleep can make these symptoms even worse. Lack of sleep linked to chronic conditions. So there are evidence to show that lack of sleep can contribute to cardiac disease, hypertension, obesity, diabetes. And ultimately, lack of sleep can affect quality of life. Lack of sleep can make a person irritable, so the person is not able to handle day-to-day stress, becomes easily angry or frustrated, and lack of energy may lead them to not engage in activity that are enjoyable. Next slide. So as a healthcare professional, how can we assess for sleep? We can do an informal or formal interview with our clients to obtain some information about their sleep history, any association of sleep problem with trauma, asking questions about their sleep patterns. What time do you fall asleep? How long does it take for you to fall asleep? When do you usually wake up? Do you feel rested after waking from the sleep? Also asking them about their sleep environment. We can also observe our patient during our session. Are they falling asleep? Are they having difficulty staying awake, concentrating? Patient may state that they're tired because they didn't sleep well. And this opens up the room for us to ask further questions. Also, there's something called sleep diary. Sleep diary can be helpful for the healthcare professional to obtain some qualitative information about patient sleep. A person documents on the chart the time he or she attempted to sleep and how much sleep was attained. Sleep diary can be completed by client or caregiver, and this information can be then shared with their physician. National Sleep Foundation has a sleep diary, which is free for anyone to access and use. And I have provided the link on the PowerPoint. So if you're interested, you'll be able to access that from the website. Also the actiography, which is a device worn on the wrist to assess sleep pattern, such as the Fitbit or smartwatch. This provides objective measurement of someone's sleep. This, along with using sleep diary, could be very helpful information for the healthcare provider to assess the patient's sleep pattern and the quality of sleep. Next slide, please. So there are several standardized assessments that can be used by healthcare professionals to assess sleep. The most two common standardized assessments used in sleep literature are Epworth Sleepiness Scale and Pittsburgh Sleep Quality Index. So Epworth Sleepiness Scale should be done with the healthcare professionals. Scores are added up to obtain a total score. It is a subjective measure of person daytime sleepiness. So the person is given a scenario and they're asked how likely they for you to doze off. And the scale is 0 to 3, 0 meaning never, 3 being high chance of dozing. So the total score greater than 10 indicates excessive daytime sleepiness and possibly underlying medical condition. So clients should be referred to a sleep specialist if they have a score 10 or higher. Next slide, please. The Pittsburgh Sleep Quality Index, it's a self-report questionnaire, and it assesses sleep quality and pattern of sleep. There are 7 domains that are assessed, and individuals are asked questions to rate on each area. So some of the areas are sleep quality, sleep duration, sleep disturbance, and then the total score, which is the global score, is looked at to see the person's sleep quality. So score of 5 or greater indicates poor sleeper. So we can use this type of assessment, and both of these assessments are quick to administer and it doesn't take too long. It gives us some quantitative information that we can share with maybe a sleep specialist or help us understand how our clients are sleeping and if we need to give some intervention in this area. Okay, next slide, please. So use of pharmacological agents should be limited when we're thinking about intervention for sleep, and it's because of the dependency issue that can rise from using medication for sleep. Non-pharmacological intervention needs to be implemented to enhance sleep. So some non-pharmacological interventions are sleep hygiene. So lifestyle modification to promote sleep, educating our client and their caregiver about creating a routine and habits for sleep. So going to bed at a certain time and waking up at a certain time. Exercise during the day and avoid exercising after evening or before bedtime. Avoid caffeine and alcohol before bed. Relaxation training. Relaxation method can be helpful for anyone with heightened arousal, which interferes with sleep. Progressive muscular relaxation can be a practice in bed before bedtime in the process for a person to help fall asleep. Mindfulness meditation has shown potential to improve sleep by decreasing stress and anxiety. Also, stimulation control and environment. The environment we sleep in needs to be comfortable and sleep-inducing. So making sure their noise level is low, the light in the room is adequate, no blue light. Blue lights are not good for sleep. Also, stimulation control, no TV, no computer or game in bed or in bedroom. Sleep restriction. So going to bed only when sleepy. And if you're not falling asleep within 15 minutes, then getting out of the bed and go to another room and do something that is not too demanding. Maybe listening to a relaxation music or reading a book. This might be difficult for some individual who has extreme pain or physical limitation. In that cases, you can stay in bed, but maybe engage in something relaxing, like listening to relaxation music or guided meditation. Sleep ergonomics, it addresses the posture and position during sleep, which helps with comfortable sleep. So avoid, waking up because of aches and pains. So if you can position the clients more comfortably in bed, or maybe even getting a comfortable mattress to sleep. Cognitive behavioral therapy for insomnia, so which is also known as CBTI. This is considered to be the most evidence-based intervention for insomnia. The way the intervention works, it helps individuals find out what type of thoughts and behavior causing sleep problems or make them worse. So learn how to replace these thoughts and behavior with habits that will support good sleep. The behavior part of the CPT helps develop good sleep habits and avoids behaviors that keep from sleeping well. So the provider of CBTI needs to be trained in these techniques. So the combination of this intervention shows to be the most effective, such as combining sleep hygiene, education and relaxation training, and stimulation control. And later on, you will hear Christopher talking about the Namaste Care. Next slide, please. So just to summarize some benefit of sleep. So immune function, when your body gets the sleep it needs, your immune cells and proteins gets the rest they need to fight off diseases. When we do not get sleep for a few days, you tend to feel like you're getting a cold or flu-like symptoms. And this is your body's way of telling you that your body needs rest. Your immune system is not working properly. Cardiovascular health, not getting enough sleep can lead to heart health problems like high blood pressure or heart attack. So lack of sleep can cause your body to release cortisol, a stress hormone that triggers your heart to work harder. Cognitive function, ability to focus better, improve memory. Sleep has been linked to improved concentration and high cognitive function, both of which can help individuals to successfully engage in daily activities. Also, sleep helps with getting better mood, right? If we sleep well, we wake up feeling rested. Being rested helps us with energy level. And when we are energized or we have better energy, life's little challenges won't annoy us as much. So now I'm going to ask Chris to go into more talking about the interventions for sleep.
Right. So, hi, this is Chris, and I'm going to talk to you a bit more about the interventions for sleep. Next slide, please. So this slide you've already seen. Nabila talked about it. It's methods for improving sleep, and I'm just going to reiterate some of the points on here. And so the use of pharmacological agents should be limited because of the dependency problems that may arise from that. And the focus of this will also focus on non-pharmacological interventions, and we'll briefly talk about sleep hygiene, education, relaxation training, mindfulness meditation, stimulation control environment, sleep ergonomics, CBTI for sleep, and Namaste Care for sleep. So next slide, please. So smartphone applications. A lot of people these days use smartphones, and there's actually a good amount of apps that are available on either the Android or through iPhone or whatever phone you have. Headspace is one that I actually use a lot myself, and you can get guided meditations, courses, and mindfulness exercises on topics like stress, general anxiety, worry, building resilience, and more topics for any moment. And based off of what you choose, they can kind of provide you with personalized recommendations every day from your search history or like the type of things that you've been searching through Headspace. And Headspace is a meditation for every experience level and lifestyle. They have the shorter 2 to 3 minute mindfulness meditation sessions. And then there's also like the prolonged ones, longer ones, and you can also cater to your personal use. And like I mentioned, they have daily meditations, sleep sounds, stress relief, and calming meditations. And I believe Headspace has different packages you can use. So I believe that the generic one is free from the app store, but I think you can subscribe for like membership and whatnot. And based off of what you're doing, you have access to more resources. And Calm is another app, and that's focuses primarily on meditation, and it's for anyone who really needs like a mental break, some soothing sounds, or a peaceful night's rest. And some of the meditations range from 3 to 25 minutes, and you can kind of choose which length is perfect for you and cater it accordingly. And they also have daily updates and daily like recommendations that you can use then based off of your previous search histories and like what you're looking for. And there's Breathe, which is a breathwork app, and that works a lot on breathing and just kind of relaxing yourself through breathwork. Next slide, please. So as mentioned earlier, there's CBT for insomnia. It's called CBT-I program, and it's cognitive behavioral therapy for insomnia. And the one that I found is from a specific practitioner, but generally speaking, if you find a clinician who is CBT-I certified, they'll kind of do similar programs with you. For this particular one I found, it's 5 sessions over a 5-week period. And the first session, basic facts about sleep, conducting your own insomnia assessment. The second session, sleep scheduling and stimulus control techniques. Session 3, cognitive restructuring techniques, sleep medication, tapering techniques, which once again, you should only really do that under the direct supervision or advice from your medical doctor and your primary care doctor. Session 4 is on daytime relaxation techniques, developing stress reducing, sleep enhancing attitudes and beliefs. In session 5, it's a bedtime relaxation techniques, lifestyle habits that improve sleep. And this program, or at least the specific one I found, was found by Dr. Jacobs, and he did a lot of sleep studies through Harvard, and he based his program here off of the information that they found doing research studies. So next slide. I'm transitioning into Namaste Care and sleep, and I'll talk about it, and I'll kind of pick out the specific parts that are more applicable. So Namaste Care overall was developed by social worker Joyce Simard in 2003 in the US. It's a grounded theory with 2 main principles, and that's on an emphasis on improving quality of life using 2 principles, the comfortable environment and loving touch. Comfortable environment is similar to like a sensory room, a lot of sensory interventions, whereas loving touch is kind of compassionate, slow, and person-centered care. It has an emphasis on using the 2 principles to improve participation in activities of daily living, or ADLs. As occupational therapists, sleep is an occupation for us. And I'll also talk about sleep kits that can be utilized with Namaste Care and for overall sleep. And those include a lot of sensory components, sense, ambient sounds, tactile sensations. Next slide, please. So like I mentioned initially, Namaste Care was designed by a social worker. It was initially used in long-term care and for hospice. And the main principles, the environment and loving touch, aim to kind of improve a person's quality of life and to increase their participation in ADLs. That being said, I've reached out to Joyce personally, and she's also stated that initially Namaste Care was for those populations, but now they've utilized it in acute care settings, home health settings, outpatient settings, and it can apply to any real population as long as you kind of follow the 2 main principles, which are the environment and loving touch. And since this was initially for long-term care and say hospice, this picture that I use kind of shows what the intended outcomes would be. So like they want to decrease agitation, improve appetite, more engagement in self-care and interests, improve communication, less pain, increased tactility, and decreased rejection of care. And the overall impact shows for family and staff would be like more enjoyable visits, better quality interactions, they're more at peace kind of situation. And the staff, increased job satisfaction, less challenging to provide care because of the individual is willing to engage more, then obviously that takes some of the pressure off staff. Next slide, please. So what is Namaste Care? Now, we briefly talked about it, and here are the overall principles for it. It's honoring the spirit within and the presence of others. You have your life story, sensory stimulation, which we'll talk about in a little bit, enabling people to be themselves, engaging in meaningful activities, food, treats, and hydration, family meetings, and comfort and pain management. Next slide, please. So comfortable space. Now, with the premise of the Namaste Care program, it's designed to be implemented twice a day, once in the morning and once in the afternoon. And the space, it's one of the principal factors in it, and the space should be available for at least 2 hours in the morning and 2 hours in the afternoon to house the program. And it should be turned into like a home-like environment. So some people use dining rooms, some facilities use like a recreation room. It all depends on where it's being implemented, who's implementing it. But the general things are, it should be free from distractions. You should have soft lighting, which is more like that orange kind of glow of a light, not the bright white LED. Relaxing music, fragrances. A lot of the research shows lavender seems to be very calming, but for others people, it may not be. So, like Nabila mentioned, you should probably do a sleep assessment and just kind of go down the list and talk with each individual or patient before you try to implement something. And blankets for a sense of safety. So next slide, please. And so practical preparations for namaste care. Now, location and view, this also may be up for personal interpretation. Some people find having a view with other stimuli to be a bit overwhelming. Some others find that having like a little view of the outdoors or nature can be very relaxing. So it fluctuates per person. The namaste space is the place that you want to have it for about 2 hours in the morning, 2 hours in the afternoon. You want to try to reduce as much stimuli as possible and try to incorporate calming stimuli for the individual. And equip the room, for example, like have suitable chairs, pillows, those kind of things, because if you're spending 2 hours there, it's a significant amount of time. So you want to make sure everyone's as comfortable as possible. Decorate the room, enhance the space with pictures, plants, etc. From Joyce, basically, she was saying that you decorate the room so that it's the most calming for the individual in question. And they can have pictures of them from the past or things that interest them, activities or hobbies that they like, identifying skills, storage space. You want to make sure you're able to pack up everything when you need to. Music, a lot of times people utilize more like reminiscent kind of music from music that the individual likes from either back in the day or just one of their favorite songs, those kind of things, or a specific time period. Personal resident supplies. Yeah, so that's for like the ADL supplies, like combs and all those kind of things. Activity items. Some people need say like a stuffed animal for more comfort or etc. Whatever works for that person. You should try to utilize it. So next slide, please. So then this is the second main principle of namaste care, and that's loving touch. And that's compassionate, slow, and person-centered care. And it can include massages of the hands and the feet, applying moisturizing cream with scent reminiscent of the past to the individual, carefully brushing their hair or providing gentle scalp massage. And one of the most important factors is talking to the individual, regardless of their ability to speak, because after TBIs, they might be a bit more limited, but at the same time, you want to just keep engaging in conversation with them, even if they're not able to respond, but you want to treat them as a person and to just kind of incorporate, just even try to include them in the conversation, even if they can't really participate too much, just to have kind of a sense of comfort and just have them know that they're involved with this as well. So next slide. So the namaste session. Like I mentioned, it's about 2-hour session twice daily, and there's a lot of appreciative, affirmative attention for the individual, meaningful activity and touch, and person-centered care. And that may include, for example, if I start from the left, like the scents in the room, that could be, some people use like diffusers or scented candles, whatever works for that individual. Touch and memory, a lot of tactile stimulation. Farewells, tell them when the session's ending, like, okay, this concludes this session, but we have another one. So they just kind of, so you kind of prepare them for follow-up sessions. In the morning sessions usually focused on the usual morning routine and then participating in their self-care tasks, like getting out of bed, getting dressed, using the bathrooms, grooming, hygiene, those kind of things. Preparing the room, this goes back to the previous point about like the comfortable space. You want to make sure it's all set up or it's allocated and you have access to it. Bringing and greeting, this is more for like when they're at a facility and staff are implementing it. You want to greet each patient or person individually, be like, hi, so and so, how are you doing today? Treat them as a human, the compassionate, caring, and you want to make the space comfortable for them. You also want to provide drinks and snacks, because if bodily functions are not met, they might not be in the best of moods or they can't participate in the task. So you want to make sure that all their needs are met so they can be fully committed to participating. Pampering, which is also, they talked about like the grooming, the massages, those kind of things. Sounds and music, that's pretty much what I mentioned earlier as well. You can have ambient noise, those kind of things, or just music that's reminiscent for that individual. So next slide, please. So namaste care implications for OTs. So as OTs, we obviously have to talk about how it relates to us for a little bit. So the focus is on individualized, meaningful activities. And the use of the program improves participation in daily occupations. And they've actually done some studies at hospices and also at long-term care facilities where the individuals who participated in the Namaste Care do have higher participation in self-care tasks and just overall engagement, which is something you want for when you're in facilities because you want them to be as engaged as possible. You want to increase their quality of life. Loving touch, increased receptivity to touch by care partners, facilitating and providing care for ADLs, such as bathing, dressing, toileting. The goal is to improve the quality of life. And there's a connection between productive aging and mental health. And studies indicate that participants and their families felt that participation in the Namaste Care helped provide a focus and purpose for the individual. So next slide, please. So now we're going to talk about sleep kits. So what are sleep kits? Sleep kits are used to facilitate improved sleep patterns, increased alertness and participation during ADLs, self-care tasks, IDLs, any of those kind of things. A sense of well-restedness, because the purpose of the sleep kit is to help the individual increase their sleep hygiene and the quality of sleep. So if you are improving your quality of sleep, you'll feel more well-rested. Reduce the time necessary to fall asleep and to improve quality of sleep. And sleep kits provide calming stimuli for individuals. They may utilize iPads, or electronic devices to assist with communication. Or like I mentioned initially, there's multiple apps that you can use for guided meditation, guided relaxation. And a lot of these apps, especially the sleep ones, you don't need to be consistently logged in on your phone. You can just kind of start it, then you can put your phone back on like the lock screen or turn the screen off so you don't have the blue light, because too much blue light, as mentioned earlier, may in fact cause you to stay more active and causes more stimuli, so then you don't fall asleep as easily. Next slide. So continuing on about sleep kits. Sleep kits can include a lot of things. They're obviously very personalized for each individual. So prior to providing a sleep kit, you really want to do a sleep assessment and just kind of with a checklist or something, go through with the individual or patient and just kind of find things that they find either stimulating or calming, because if they're identifying certain things stimulating, then you probably don't want to include it in the sleep kit. And this is a very broad kind of sleep kit information. So some people prefer earplugs. Like I use the headphones you see me wearing. These are noise canceling. So I usually put them on at night because they just kind of out all the sounds. Ambient sounds, there's noise machines. Some people like religious chanting, and there's like sounds like ocean, rain, those kind of things. I have an Amazon Echo, and I just have that play ambient sounds at night too, just so there's some background noise. Ambient lighting, you have night lights or soothing colors. Remember, you don't want like the institution bright white LED lights. You want to have something that's a lot more warm and just kind of soothing. And that can include, for certain people, it includes like that orange kind of a yellow kind of a light bulb. For some other people, they use night lights, different colors, and I'll explain about that in a little bit. Scents, preferably hypoallergenic scents that are calming, and this fluctuates per person. Some people find citrus to be very stimulating. However, some people also find it to be calming. Lavender, chamomile, those kind of things are generally considered calming. However, if you're allergic to those scents or it just doesn't work with you, then obviously that probably won't be for you. There's tactile sensations, for example, weighted blankets of different textures may provide like a calming sensation. Personally, I use a weighted blanket at home. The one I have is about 15 pounds. And I just really enjoy this kind of proprioceptive input that I get and the tactile sensations on it for me. And that has definitely helped me increase my quality of sleep. And that may be something you want to look into. And next slide, please. So this is just a generic sleep kit I pulled off of Etsy. Now you see there's an eye mask, there's a scented candle, there's earplugs, there's some bedtime relaxation tea, there's some fragrances, and basically a lot of sleep kits, if you look online, they kind of have them pre-made. I would encourage you to just try to figure out what that individual prefers before buying one of these straight up sleep kits, because like I've been saying, every person is slightly different, and you just want to make sure that what you're providing for them for their sleep kit is actually calming and not agitating them in any way, shape, or form. Next slide, please. So like I mentioned, some people use like a orangey yellow kind of a light to provide comfort and for sleep. This light actually is one that I actually have in my room, and it's just kind of the one that I have mimics like the Northern Lights kind of situation, and it fluctuates from red to blue to green to purple, a few other lights. And I just kind of have it in the corner. I put that on, it lights up the wall, and I just kind of watch the patterns for a little bit. I find it really soothing, but some people may find it to be very alerting or agitating or the opposite. So this is also available at like Walmart, Amazon, any of those kind of things, but you want to try it out with the person before providing it with them for long term. So next slide, please. So sleep kit and namaste care. So as I talked about namaste care, it was designed for 2 hours in the morning, 2 hours in the afternoon, and it was primarily focused on increasing quality of life and also engagement in self-care tasks. Now, as occupational therapists, sleep is an occupation for us, and the sleep kit also kind of goes in turn with namaste care because a lot of sensory components and all those kind of things. So having a sleep kit available, each individual completes a brief questionnaire about what sensory technique stimulates or calms them. That can be assisted by the family or medical professionals. Or, for example, if someone has difficulty speaking or kind of communicating, their family could also, or loved ones or significant others can also be like, oh, I remember before this, the individual found this to be calming, stimulating. And of course, you can also work with like sleep specialists, medical professionals to kind of go through such questionnaires. And you want to create a sleep kit for the individual based on their selected choices on the questionnaire. And you want to educate the family, providers, etc., on how to use them and what's provided if they have difficulties with sleep. Next slide, please. So this part I kind of wanted to talk about because this is New Jersey, where you know that there's both medicinal and adult use are both legalized in the state. Strictly for this purpose, I'm going to talk about the medical side of things. I actually have my medical cannabis certification. I studied medical cannabis at the Pacific College in San Diego. I took it for 3 semesters, and I was a lot of the research that's actually available in the US shows that it may improve sleep and treating a range of sleep disorders. Now, for this, I'm going to talk about strictly medically based, not adult use, recreation use. This is for individuals who have gone to see a certified doctor who has recommended that medical cannabis be used as a alternative or as a modality for helping increase sleep. And CBD in particular is known to have potent neuroprotective properties, and that it's actually patented by the US federal government, if you can believe that. The US National Institute of Health owns a patent for medical use of CBD, and that was established in 2003, and the patent number is listed there, and it basically states that CBD as being a potent antioxidant and neuroprotectant and is very safe for human consumption. That's what the federal US patent says. And in 2003, a trial found that the equal combination of THC and CBD to be used effectively to treat pain and muscle spasms resulting from brain and spinal cord injuries, which also may impact a person's ability to sleep, because if they're trying to sleep and they're in significant pain, they're having muscle spasms, sleep is not going to go very well for them. And studies indicate that the use of THC and CBD to be helpful in treating those. And before I go any further, THC, if we're familiar with that, that's what causes the psychoactive components of when people say they're getting high off of cannabis, that's the THC. CBD doesn't have the psychoactive components, and it's used to treat a lot of conditions, including anything regarding the brain, spinal cord injuries, a lot of pain, and insomnia too. Combination of THC and CBD at probably like a 50-50 ratio has been shown to be the most effective method for assisting with sleep. And so, next slide. Thank you. So we're going to talk a little bit more about CBD and THC. So cannabinoids like THC and CBD may reduce the trauma and symptoms that follow brain injury because of their interaction with the endocannabinoid system. The literature for the endocannabinoid system, or ECS, basically states that each person has like a natural endocannabinoid system in their body, and certain things like pleasurable activities, interests, those things will elevate the ECS. And an elevated ECS, you feel more relaxed, less stress. And well, one of the literature I was reading said that somehow, like, for example, like doing yoga, movement-based things, even a little bit of that quote unquote runner's high, they said may be like a side effect of the endocannabinoid systems for the individuals out there who do the running. I personally don't run. I like short walks to the fridge, and that's about it. But a lot of people say they get like a runner's high, and some of the literature indicates that that might be a result of the endocannabinoid system. And also in 2011, the British Journal of Pharmacology described the ECS as a self-protective mechanisms that's activated in response to a stroke or TBI. And they found that endocannabinoid levels in the brain increase significantly during and immediately after TBI. And they activate the CB1 and CB2 receptors, which are cannabinoid receptors, which protect against TBI-induced neurological and motor deficits. And by manipulating the endocannabinoid systems with cannabinoids through the use of, say, CBD or THC or a combination of both, medical scientists have been able to reduce brain damage and improve functional recovery in animal studies of stroke and TBI. And of course, I stress this is for the medical patients who have a medical card, and this is under the clinical supervision of a medical professional. So next slide, please. And so NJ and cannabis. So like I was saying, cannabis is legal in the state of New Jersey for both recreational and medicinal purposes. If someone has a TBI, I would recommend, and a lot of the other true pharmacological methods aren't working, and the use of sleep kits and alternative methods are not as effective, I would recommend maybe you could talk to your primary care physician and apply for a medical card from a licensed physician and speak with medical cannabis pharmacists or cannabis consultants to identify the appropriate dosing and timing, because with cannabis, there's a whole dosing can be quite challenging, especially for newer individuals using it. And it's best you do it under medical supervision and those kind of things to help maximize pain reduction, inflammation, and other issues that may impact sleep. And I've actually put a website on there, the projectcbd.org. They're at the forefront of researching CBD and how it can affect certain medical conditions. And they have a whole section about the use of CBD for TBI clients, and it's for either for like reducing agitation, increasing sleep, reducing pain, inflammation. They have a lot of articles, and it's updated pretty frequently. I'd say there's like a new article like every other day or something, and they're a great resource if you want to learn a little bit more about that. Next slide, please. And so I'm going to transition this into the Love Your Brain program. The Love Your Brain Foundation is a nonprofit organization that improves the quality of life of people affected by TBIs and raises awareness about the importance of brain health. Now, the Love Your Brain Foundation provides a lot of excellent resources for TBI survivors, patients, caregivers, providers, but they also have two things that I really found interesting. The Love Your Brain, there's two types of free 6-week programs. You can connect with the TBI community. You'll receive weekly tools, a brief video. You can do yoga with them, meditation, yoga. You must have Zoom, reliable internet and device with audio and webcam. And the two programs are, the Love Your Brain programs are, one is a 75-minute online with live yoga and group discussions. And the other program is 45 minutes online meetup with group discussions. And this focuses on connecting you with other TBI survivors, support groups, as well as providers. And the Love Your Brain program, I really enjoy because it was designed specifically for individuals with TBIs, and they have a whole dedicated yoga program that is designed for patients and survivors of TBIs. And a lot of professionals, and I know a few therapists and practitioners who went through the training, because you can sign up and they provide the special Love Your Brain yoga training certification and practice, and from there on their website you can also locate if there's any Love Your Brain clinicians or yoga or like community centers that offer this in your area. So if you go on like the Love Your Brain Foundation, you can go check it out, see if there's anything happening in your area, and if there isn't, remember they have fully online programs as well. And I'm not the best with yoga, but I believe Dr. Enam knows a little bit about yoga, so she can talk about like one or two poses that are better for relaxation.
So certain position in yoga, doing it prior to going to sleep can be beneficial. So one of the pose would be the meditation pose, where you're sitting kind of upright position. If you are able to, you can cross your legs, or if that's not possible, you can have your legs straight in front of you, and you can also use your bed pose as a back support to maintain that position. And just kind of, using that with like a deep breathing technique or even some type of mindfulness meditation. The other position we call the Savasana, which is basically you're laying on your back and you're relaxing your arms, your leg, just consciously letting go of any tension in your muscle, including your jaw muscle, just to relaxing. And then if you combine that with like an eye pillow, and some of the eye pillow has like different scent, like Chris was talking about, like even lavender, and you can put that on, and that could help you get into that sleep stage. So I would say those probably the two most doable poses while you're on bed. There are some other poses like leg up the wall. I probably wouldn't advise that, unless you have somebody who knows yoga and they're with you. But I would say the meditation pose, and you can use your bed as a support using the back of, the headboard of the bed, and also pillow. You can use pillow to support you and getting into that position. And then the Savasana pose, that would be probably helpful with also using an eye pillow with that. Chris, back to you.
Gotcha. And I think we're going to transition into a brief activity. So next slide, please. So activity 1, person A recently sustained a TBI due to motor vehicle accident. Person A's wife noticed that he is having difficulties falling asleep. If you were the wife, what would you do to facilitate sleep for person A? And I think you could probably message us your thoughts or.
Yeah, so if people would like to participate, you can put your comment in the Q&A and we will receive it and read it out.
Yep.
So Chris, we have one individual commented, consider to begin a sleep journal.
Okay. Yep. That's definitely a good one.
You could
And
also,
yeah, sleep.
you could probably use the sleep diary too, if you want to, so that would work.
Yep. And basically you can jot down in your sleep diary, your sleep journal, what time you've been falling asleep or what things have been keeping you up. And the plan, how that works is you just kind of track what is causing you to either fall asleep more easily or causing you to stay up. And by tracking through the journal or diary, you can try to see like what patterns there are. And from there, you try to eliminate stimuli or try to work around it to try to increase your sleep.
We had some more comments. First, trying to understand why and improve the environment, have a bedtime routine that includes relaxation, and then also discussing with the doctor if any medications could be affecting their sleep.
Absolutely. Certain medications may have a side effect of causing you to stay up. So if you want to speak with your primary care physician or your doctor, see, hey, is this causing sleep issues?
Another one, using white noise, weighted blanket, or other sensory interventions.
Yep, absolutely.
Great answers.
And I think because for the sake of time, we'll move on to the next slide, which is another activity. And this is more, you notice your client B is falling asleep during your session and having difficulty following your directions. If you are the healthcare professional working with this client, how can you gather more information about this person's sleep pattern and sleep habit? And name 2 non-pharmacological interventions you can use. I'll probably give you like 5-6 minutes to do this, then we'll share and go over it. So yep, I see someone responded with the Epworth sleepiness scale. That's definitely one way that the healthcare provider can kind of see what's some issues that may be causing some sleep. And could a walk 2 to 3 hours before sleep be beneficial? Yeah, you don't want to do it right before sleep, but a little bit of exercise, like Nabila said earlier in the day, would definitely help try to burn off some extra steam or maybe help you relax a little bit.
Yeah, you don't want to do I would probably say more during the daytime, the walk and physical activity, not probably so close to the sleep time, because that tends to increase your energy level, so might have difficulty falling asleep. But exercise is definitely good during the day to help prepare for sleep.
Yep, and have the client or caregiver keep a sleep journal, ask questions about the bedtime environment. Absolutely, that's something that we highly recommend. Guided meditation. Yep, definitely something that you can utilize, and you can use it through the apps, or I know YouTube has a lot of those things that you can watch for free as well if you don't want to pay for a subscription or membership to anything. That's how I started using like guided meditation. I would just use YouTube with my noise canceling headphones before I go to sleep, and that became kind of a routine for me. I'm not too familiar with Kava, so I really don't know that.
Same here.
And we have a few minutes left, and I think we got enough answers for the activity. So the next slides, I believe, are just our reference slides. So if anyone else wants references or whatnot, you can always ask us to send you a complete list of references and all the resources that we used for this.
There's some questions, I think.
Yes,
Yeah.
so if you guys are done, we can then transition into the next part of this presentation. So thank you so much for sharing all that information, Chris and Nabila. And we're just going to take some of the questions that we have now in the last couple of minutes that we have. So the first one, I'll scroll all the way back here. We have somebody who mentioned that they have a patient who complains of sleep right after lunch. He says that he sleeps well, but then he falls asleep very easily after lunch. So is there any insight you could give to that situation?
So the literature shows that short nap can be helpful. So no more than 20 to 30 minutes of nap. So if this person may be trying a nap during the afternoon time, sometimes nap helps to kind of energize and gives the body that boost they need, but definitely no more than one nap, and should be between 20 to 30 minutes, not longer than that. That could be something to try out.
Great, thank you. Then someone was wondering if audiobooks could maybe be beneficial, I guess part of the sleep kit.
It definitely can. Like even on Calm, the app, they have I think one of the features they have is they have celebrities with soothing voices like read the literature to you. And I mean, for some people, they find that to be very, very calming. For example, like I don't know if James Earl Jones is reading to me, like I'd find that really calming. But some people, yeah, like some people have different. So you can certain celebrities and other like movie stars or singers, they'll narrate certain things, and a lot of times those narrations will also include some ambient sounds while layered with them reading over it. And for some people, they find it to be very relaxing. I just love reading in general, so I usually read a book before I go to sleep. I don't do the audiobook because I have like the ambient sounds via my headphones, but I do a lot of reading, and I find that to be just calming for me personally.
Okay, great. Thank you for that. And then there was a question about tinnitus. Would earplugs magnify that?
That is a good question. I'm not too sure myself personally. I'm just gonna actually have to look it up later today. But for some individuals, maybe if the earplugs don't work for them. Like I have the noise canceling headphones, and they work wonders for me, because when I'm listening to something, I don't want to have the outside world stimuli kind of interrupting me. So with the noise canceling headphones, I can also adjust like the volume. I can also set. It allows me a lot of control over what I can do with whatever I'm listening to, and the nature of the noise canceling headphones themselves. So if earplugs are causing problems, noise canceling headphones, they might be a slightly better solution for individuals. It's also you kind of have to trial and error.
Yeah.
Great, thank you. And then, is there any relation to time people wake up or taking naps that interfere with evening sleep?
So yeah, so you shouldn't be taking naps very close to your sleep time, because that might just make you stay awake. And I just said, nap should be shorter and shouldn't be more than one time a day. So if somebody needs that little afternoon nap, that's okay. Some people do need that, but it should be like 20 to 30 minutes. If you're napping and waking up like an hour or two later, that's not good.
Right.
Definitely not close to sleep time either.
Thank you. Let's see here. And then any suggestions for what to do if somebody will wake up from a nightmare?
I don't, and I don't want to give any advice, because if it is related to more like a sleep problem that I was mentioning about earlier. People has night terror for which is very common in TBI population too. Then you need to see sleep specialists, and there are sleep clinic. I know Thomas Jefferson has a sleep clinic. That there are many specialty who looks at sleep related issue like narcolepsy or insomnia or parasomnias, which may be the cause of the night terror if they have parasomnia, which definitely needs a sleep specialist for that.
Thank you. Well, it is 1 minute after 1, so we're gonna stop here. But if anybody has any questions that were not answered today, please reach out to me. I will put my email in the chat and we can send your question along and make sure that gets answered. And also in the chat, we have our post webinar evaluation. So please click on that and complete it. And again, if you need a certificate of attendance, you need to complete that in order to get it. So thank you all again for attending today. And thank you so much to Nabila and to Christopher. I really appreciate you sharing your expertise and knowledge today. And please, again, if anybody has any questions, comments, pass them along. And hopefully we'll see you at our next webinar on June 20th. So this concludes today's webinar.
Thank you for attending, everyone.
Thank you.